the VA Scheduling Accountability Act. In 2014, news reports uncovering gross mismanagement and schedule manipulation at a Department of Veteran Affairs hospital in Phoenix shook us all to the core. Through hearings held in this committee and investigations by the VA, OIG, and GAO, we together substantiated many of the allegations of manipulated schedules and falsified wait times data at the Phoenix facility. The manipulation of appointment schedules and data in Phoenix led to at least 40 veterans dying while they were waiting for care. However, as we all took a closer look, we discovered that, sadly, this was not an issue unique to Phoenix. It was systemic. Here we sit 2 years later, digging deeper into some of the root causes to ensure that no veteran ever dies again waiting for care. So I introduced legislation this week, the VA Scheduling Accountability Act, that gets at one of the key drivers of the wait time manipulation. A 2010 VA directive and VA's implementation processes and procedures policy for scheduling at their facilities and contains 19 different items on the checklist. The directive requires an annual certification of full compliance with all items on the list. For instance, facilities are required to ensure completion using VISN-approved processes and procedures of a standardized yearly scheduler audit of the timeliness and appropriateness of scheduling actions and of the accuracy of desired dates. They're also required to ensure that deficiencies in competency or performance are identified by the annual scheduler audit are effectively addressed. An August 2014 OIG report uncovered that in May of 2013, the then Deputy Undersecretary for Health for Operations Management waived that FY 2013 annual requirement for facility directors to certify compliance with the VHA scheduling directive, allowing facilities to only self-certify reduced oversight, overweight time, data integrity, and compliance with appropriate scheduling practices. This, in turn, allowed VA's data to be easily manipulated, contributing to the wait time scandal. There was a noticeable, substantial improvement in VHA's appointment scheduling after VA waived the directive, but as we all know now, that improvement was an illusion. While the VA has reinstated the certification requirement, there's nothing stopping them from waiving it again. The VA Scheduling Accountability Act would simply require each facility director to annually certify compliance with the scheduling directive or any successor directive that replaces it, and it prohibits any waivers in the future. Should a director be unable to certify compliance, either because the facility is not in compliance or the director refuses to sign the certification for some other reason, the director must submit a report directly to the Secretary explaining why the facility is out of compliance. The Secretary will then have to report yearly to the House and Senate VA committees with a list of facilities in compliance and those that are not, with an accompanying explanation as to why they were not in compliance. This will provide more oversight of the Department and ensure Congress is aware when VA is waiving these policies. Waiving compliance requirements was a key driver in the wait time scandal, which continues to be an issue with the Department. This legislation will begin to end that reckless practice once and for all, while increasing accountability and transparency at the VA as we work on ways and continue to work on ways to ensure that those who risk their lives for their country receive the prompt, quality care that they've earned. I look forward to working with the members of this committee, veteran service organizations, and the VA in addressing this critical issue. And I again thank you for allowing me the opportunity to speak today, and I yield back.
Thanks, Ms. Walorski. Mr. Zeldin. You're recognized.
Good morning, Chairman, and thank